Hello everybody, this is Dr. Zacharias. I'm a doctor in maternal-fetal medicine. I practice in Houston, Texas, and I wanted to give you a message about how to protect yourselves during and after your pregnancies at the end tail, hopefully, of this pandemic with COVID-19. Having worked and lived through the pandemic here in Southeast Texas over the past 3 years, I can tell you that, unfortunately, the number of complications we have seen as high-risk obstetricians skyrocketed during the pandemic, especially around the summer of 2021, with a large number of maternal mortalities, deaths, as well as a large number of fetal deaths or stillbirths, as well as neonatal deaths and morbidity, not just deaths, but also babies that became sick from being born preterm, and mothers that became sick for preeclampsia, abruption of the placenta, or combinations of the above. Over the past 2 years, thanks to the actions of both administrations, a rapid supply of very effective vaccines was provided by both Pfizer, Moderna, and other companies that are now in use and highly recommended for all pregnant individuals, not just in Texas, but around the country. We have now studied hundreds of thousands of pregnant women that have been vaccinated with these mRNA vaccines, and the outcomes have been excellent. Very good immunization, producing antibodies that protect both the pregnant person and the fetus and the newborn during the lactation period, with production of robust antibodies responses that continue to protect, as I said, mother, baby, and placenta. The target of the virus nowadays is not so much the lungs of the pregnant individual, but the placenta, unfortunately. And so it can cause clotting or thrombosis of the vessels of the placenta, inflammation, and the complications of that will be growth restriction or small babies, preterm birth, preeclampsia, stillbirth, and complications of the above, including a C-section. All of those things we have seen and will continue to see, but the scientific studies are in. The vaccines work extremely well, protecting women to the point where they're not even different from the unexposed population once they have been fully immunized. Unfortunately, our experience has been here in Houston that only about 15% to 20% perhaps of pregnant individuals are fully vaccinated, including getting the bivalent booster vaccine that's currently available in your local pharmacy. Only about 1 in 6 women have been actually vaccinated fully at this point. And that is a big shame, because there's a large number of pregnancies now that are still exposed to this virus that, as time has continued, has become more indolent and more benign. However, it can still wreak havoc in the placenta and cause bad outcomes for these pregnancies. So I urge you all to get vaccinated. This is my best advice to you. Of course, we recommend vaccination against the flu every season too, but getting vaccinated against COVID at this point, including the most recent bivalent booster vaccine, is a very good idea, and I can wholeheartedly recommend it to prevent complications that we can otherwise not prevent or avoid. So I hope you will take this message to heart. It will only help your pregnancy get healthier. Best regards.